Excuse me, hi.
Yeah, I think that we're ready to start. So thank you. My name is Lisa Peterson. I'm the Deputy City Manager, and I also chair the Community Benefits Advisory Committee. And I have to say on behalf of the Advisory Committee, we are absolutely thrilled that we're at the point that we are and that the RFP has been released and that we're really, really looking forward to all these proposals that are going to come in. So we're very excited about that. I'm going to just very briefly, first I want to say that the meeting is being audio recorded today and probably video recorded as well, so just to be aware of that. We are going to put this on the website after, so people that may have missed the presentation or whatever will have access to that. We're going to try to do the Q&A section as well, but we're not sure how that part's going to go in terms of that, but to be honestly, we're doing that. I want to just note that there's a number of people that are really on this Community Benefits Advisory Committee that have put a lot of work into this, and there's a number of them in the room and others that were not able to make it today. But really, there's representatives from the nonprofit community, from the Cambridge Community Foundation, from business, from university rep, and a number of Cambridge residents, and you will be hearing from other members as they will introduce themselves. But I'm wondering if people who have been on the committee that are here, if you can raise your hands. There's a few in the back, Liz and Ellen and Amy and Rowan and Sandra. And of course, we've been so well supported in many ways by Wendell Joseph, who's been speaking, and by Daniel Weinstock, who's been helping us with the facilitation. So today's agenda, we want to talk a little bit about background, about how we got here, background and overview of the process. We then want to get into the planning grant RFP for the proposals, both the goals and requirements, and then once we go through that piece, we want to have a question and answer period. I'll say that we will do our best to try to answer questions today, but at this point in the process, just in fairness to everyone and being very transparent, there may be questions that if they're straightforward, we can answer them here today. There may be questions that we just want to write down and note, and we promise that we will answer them and we will do it online so everybody gets to see the answer to them. But we may need to just be a little bit more thoughtful about how we're answering them or whatever. I do have to say, for members on the committee, you may know people on the committee. I mean, Cambridge is a small community. We're not able to answer your questions individually at this point without it being a conflict of interest for us. So it's like questions either need to come at this meeting, have to either be emailed to us, we'll have another meeting in January to ask additional questions, and then we answer the questions online. So just to really sort of understand that this process is just a little bit more formal at this point. So then, as was really asked by a number of people, we have Cliff Cook from the Community Development Department has also joined us, and we're going to do a data and demographics short presentation. Some of the data, he has sort of up-to-date data, and then there'll be a Q&A with Cliff after that about the data. All of the presentation material, if it's not, will be on the website. Okay, so people don't have to be worried about writing it all down. It will be available on the website, and I think people are able to have copies of the RFPs also. And then, the meeting can either conclude then, or there's an opportunity that we're going to have at the very end of the meeting, which we're not facilitating, but we're just suggesting that, there may be a part of the room that people want to talk about housing, or that deliver services, or looking for somebody that maybe delivers services that might address some of those housing insecurity needs, or financial insecurity, or the mental and behavioral health, because those are identified as the top tier needs. And just to know, we're really trying to encourage partnership here, and some organizations may be very strong in one piece, but might be looking for a partner in another piece. So that's why we're sort of informally, just after the Q&A, as a suggestion. People do not have to participate in it, of course, but it's a suggestion that people divide up and to see if there's other people that are interested in sort of networking about that issue. So at that point, I am going
afternoon. So I'll briefly just provide some background on this process and the committee's work. And this is work that began in 2010 when community benefits funds were first being pledged to the city. Since then, there's been quite a bit of work to get us to the point where we released the planning grant RFP 2 weeks ago now. The evaluation RFP was also released last week, Thursday. What preceded that was the community assessment, which I'm sure many of you were a part of or at least aware of. And even before that was the creation of the Community Benefits Fund in 2015. So this is, again, a long time coming. There's been a lot of different moving pieces, a lot of work being done, and we're very happy with where we are at this point in time. Just quickly about community benefits funds. These are funds, public funds that are pledged to the city by developers through the enactment of zoning amendments or agreements. Since 2010, there's been $23 million pledged to the city. Most of that has been from MIT. But because these funds are tied to the development process, not all of it has been received to date. We only have about $7.5 million in the bank right now, so to speak. And those are the funds that are being used for this first round of funding. The additional monies, we're not sure yet when they will be received because, again, they're tied to the development process. So even though they were pledged since 2010, we did not start receiving them until about 2015, 2016, when the Community Benefits Fund was created. These are the guiding principles for Community Benefits Funding, and they have been adopted by City Council. These are very, very important to this community, to this process. This has been something that we've looked to since the very beginning when we began putting this framework together. I won't read through every single bullet point, but I do want to highlight how they've been broken apart. One part talks about the need to frame needs thoughtfully, right? And that includes realizing that we need some support to provide some support for vulnerable underserved populations, that we should be mindful of who's impacted by development, or where the needs are the most pressing. Another section talks about building on the existing assets in the community ecosystem, recognizing that there's already a lot of good stuff happening, and there's a need to tap into that a little bit more to pull things together in a more cohesive manner. Promoting holistic approaches to innovation and collaboration. This has been a very, very important part of this process, and it's why it's unfolded the way it has. We wanted to be open to bold and innovative approaches. We wanted to be able to, in recognizing that these are complex issues and it takes time to address them, wanted to take a deliberate approach to how we meet these needs, how we provide services, and that includes being able to pull organizations together in a way that maybe might not be available before. But all in all, the idea is to try to meet the needs of community residents as best as we possibly can. And finally, trying to simplify the application process, trying to be as transparent as possible, provide the opportunity to continue funding those programs that are doing a tremendous amount of work. That's a quick overview of how we got to this point. I'll turn it over to Amy.
Hi everybody, my name is Amy Solomon. I'm a member of the Community Benefits Committee. I'm a resident of Cambridge and a residential member. So I also work in evaluation and with this population, so it's a great honor to be part of this process. I'm going to try to condense what's a rather complex RFP into some of the highlights. And that's what this slide shows. There are really three big highlights, I think, to keep in mind about the RFP. One has to do with the goals for the project. The second one has to do with what are the top tier needs, how do we come to that, and who's the target population. So I'll try to give you just a little more information on those particular three important areas. So this slide tells you about sort of three layers or levels of goals. The overall, sort of overarching goal about this project to remember is that it really focuses on promoting partnerships, coordination, and integration. And sort of why is that? From my perspective and from working on this committee, there are sort of two big reasons why partnership and coordination were really considered so critical. One had to do with a belief that we really wanted to stimulate innovation. And that the best way to do that, or one important way to do that, is to bring people together who don't necessarily work day to day with each other, to think out of the box, and that partnerships and collaboration is a really important approach to stimulating innovation. So this grant is about innovation. When you read the RFP, you're going to see that all over the place. The second reason is that we really recognize that that individuals don't have sort of one particular need, and these top-tier needs are very interrelated. And so an important way of helping families and children would be to think about their needs in a much more integrated way, so that we don't have sort of fractured systems of care, but a really integrated approach to meeting multiple needs when they exist within a family. Okay, so in addition to that sort of overarching framework about partnership and coordination, there are a set of short-term goals and a set of long-term goals. Examples for both of these are in your RFP on page 6. So I'm just going to read through this quickly. The short-term goals really focus on the tiered needs, the top 3 tiered needs. And so the short-term goals have to do with enhancing housing stability, economic stability, and family well-being, and also enhancing the connections to services that provide appropriate supports for those areas. Long-term goals go a little further, so we're increasing family housing and economic stability rather than enhancing or just kind of linking. We're enhancing child and adult resiliency, and we are looking for some real systems level change that allows Cambridge to sustain some of the what we're hoping are real benefits from looking at partnerships in this way and creating systems of care in this way. So the top tier needs, and most of this is in your appendix in the RFP, where you have the community needs assessment. It talks about a prioritization process of coming up with Cambridge's needs. We're focusing on the top tier needs. So that's affordable housing and homelessness, financial security, and behavioral health, both mental health and substance abuse needs. The slide on the right-hand side has middle tiered needs, lower tiered needs. Just to comment, we do expect applicants to address all 3 of these need areas, but we are not going to tell you one has more weight than the other, or you should have them equally weighted. You can do that as you will. And by the way, in terms of the partnerships, what we're expecting is that there's a lead agency, but that partners will be along on the application. Okay. Target population. So our target population for this initiative are families with children that are low income or living at or below the poverty threshold, particularly those headed by a single woman. The committee determined the target population based on kind of an intersection of 3 areas of needs: highly vulnerable populations within Cambridge and their needs. And I think the demographic presentation later will help underline why do we choose this target population. That includes families with children at low income or living below poverty, and families headed by a single woman. These 2 charts here on the left, that chart is the threshold or cap for poverty income. The one on the right is the threshold or cap for low income. So if we're talking about a 3-person household, the poverty cap would be $20,420, and a little more than twice as much for low income, or $48,550. Okay, I'm going to turn this over to Rowan.
Hi, my name is Rowan Murphy, and I'm also a community resident member of the Community Benefits Advisory Committee. I've been a Cambridge resident for over 20 years, and professionally have worked both in nonprofit administration and in grant making. And so, like Amy, I've been really excited to work with this committee and bring some personal and professional experience to the work. So I'm going to talk specifically about the planning grant phase. As you can see from the timeline, those are the sort of critical dates, and I think that the most important going forward are, after the information sessions, the February 15th planning grant proposal due date, and then the April 15th planning grant award date, anticipated award date. So I'm going to focus particularly on the goals and requirements of the planning grant phase. So the overview is, as we've said, the Community Benefits Competitive Grant process is divided into two phases, a planning phase of 6 months and a 3-year implementation phase. A reminder that it's, as it says in the RFP, that grantees must participate in the planning phase in order to be eligible for the implementation phase. And we had a lot of discussion about this particular requirement, but we feel that, as Amy talked about, with collaboration and new partnerships being formed, it's really important to give organizations that time to develop that partnership and really be ready to be able to implement a program model at the end of that period. So during the planning grant, ramp up to the planning grant phase, applications will be submitted and reviewed by CVAC and potentially by some external reviewers. The grants, once awarded, will be up to 5 planning grants of up to $30,000 each. And the partnerships that receive a planning grant will use those funds to further develop a plan for implementation that will be reviewed at the end of the 6-month planning phase. So proposal submission requirements, as I mentioned, the deadline is on February 15th by noon for the proposals to be submitted. There were a bunch of, sort of in the RFP itself, specific sort of requirements about number of pages, font size, a variety of other things, additional documents. You can look at those specifications in the RFP itself. But the main components of the proposal application, which will be submitted by the lead organization, include a title page, which should have a 250-word abstract describing the proposed project, the grant amount requested, and information about the partnership's lead organization. The second section is a description of the approach to the target population, the work that will be done with them, the vision of the partnership, specific information about partnering organizations, and information about the lead organization, particularly its capacity to act in that function, and also its history with working with other partnerships. The third section is an initial plan for the program model and how the program model will address all 3 of the top the top tier needs, the 3 top tier needs that we've identified. And then the 4th section of the application are additional documents, which include a planning phase budget, information about the lead organization, its board composition and staff composition, and letters of affirmation signed by all the partners in the partnership. So what are we going to be looking for as we review planning grant applications? I think that first thing is clarity of vision, which means an overall approach of the proposed program model. The ability of the partnership to address all 3 of the top tier needs that respond to the unique needs of families that are being served. An approach to equity and inclusion that creates a fair and equitable program for addressing economic, educational, and racial disparities in a meaningful way. Demonstrated commitment to the partnership and the collaboration of the partners. Knowledge and experience with the target population. Ways that the target population will be engaged in the planning and the implementation. And the capacity of the lead organization to work with the city, with the evaluator, with partner organizations, and to fulfill the data requirements of the grant. And some initial or preliminary articulation of anticipated outcomes and service delivery plan. Knowing that that will be fine-tuned during the planning phase for the implementation process. So when we talk about partnerships, the committee has given a lot of thought to sort of what we mean by that and what makes a collaborative eligible for consideration as a partnership. And some of the things that we agreed upon were that the partnership should have a shared vision and approach. So the partners in the partnership may play different roles and they may contribute to the partnership in different ways. We want to make sure that each partner's voice is heard and equally respected, that the partnership is able to address all three top-tier needs in ways that respond to the needs of families, that a partnership includes at least 2 partners, that the partnerships share and pursue resources and have a shared commitment to achieving goals, that they're committed to engaging families that are being served in both the planning grant period and during the implementation, and that they also are committed to having continuous feedback from those who are being served, the families, and where it's appropriate, maybe youth voice, on the types and mix of services that are being offered, the support being offered, program quality, ways to improve the program. And then lastly, the partners and the services in the partnership are reflective and responsive to the cultures, races, ethnicities, and languages of the families being served. So what do we mean when we talk about the lead organization? So generally, the expectation is that a partnership has to identify a lead organization for the partnership. And that lead organization needs to be able to enter into a grant agreement with the city and manage the sub-agreements with the partner organizations. A lead organization can only be the lead on one proposal, but it could be a partner on more than one proposal. And organizations that are not leads but are partners can be partner organizations in more than one proposal. So specifically about lead organizations, some of the criteria that we've established are that the lead organization needs to be a 501c3 nonprofit that's based in Cambridge and benefits or serves Cambridge families. That it has some prior experience participating in partnerships. It has the administrative capacity to manage grant and partnership requirements on a fiscal level, staffing level, reporting level. That it has the ability to represent its fiscal responsibility through audited financials for Form 990 and an operating budget. That it has data collection experience or at least a willingness to engage a data coordinator to help fulfill the data requirements of the grant. That it's willing to support the evaluation activities, that it's willing to support the equitable and inclusive partnerships, and that it has the capacity to act as a facilitator and convener of partnering organizations, or if that function is not already on staff, that it will go out and identify somebody and engage someone who can be an effective facilitator and convener for the partnership group. That it reflects the families or the communities that it serves, evidenced by the demographic information that we're asking for about the board and staff, and that it could provide references that speak to its ability to be the lead partner in the partnership. Turning it back over to Lisa.
Wonderful, thank you. Just because it's being televised, I know that, not televised, video. We need to use the microphone, but, you know, if you don't have a question right now, I just want to actually make it really clear that you can send questions that you have regarding the RFP anytime now through early February to the purchasing agent. So purchasing@cambridgema.gov. If you happen to send them to community benefits, we will forward them over to purchasing. But we would like the written questions to go there. You also can do it at the next meeting that's happening on Wednesday, January 16th. If people want to think about that, we're going to have another meeting. It'll be similar unless we're hearing feedback that people want to hear more about a particular area. And again, all the questions that we look at, we're going to put out on our website so everybody gets the opportunity to see them. But for now, I'm going to ask for help from other members of the committee. I'm wondering if there are, thank you. If there's any questions of the RFP process, final questions.
Hi. I'm wondering if you could speak a little bit to the data collection element. This is not particularly about the proposal, but you mentioned kind of managing the grant and what kind of data are you looking to collect?
So that would be covered. I don't know. We are hiring an evaluator that will be working with each selected partnership to help develop the model and develop what the data. We don't have more specific information at this point, or if we do, we will put that out on the website. But that is what, in terms of developing the plan for implementation, that's going to be a part of the plan that's being developed. Oh, I know, Fran had a question right here.
Yeah, so,
Fran, I'm sorry, but I'm going to ask you just a minute because of the
turn around. Oh.
the television.
So you mentioned the partnership and how important that was, and you said perhaps people you don't work with day to day, but what if you do work day to day with other nonprofits?
Absolutely.
Okay, just wanted to
Yeah,
clarify
absolutely.
that.
Absolutely.
But that wouldn't be a negative. That
No,
would-
absolutely, absolutely not. That's,
I have a question about the types of partners. Do all partners have to be nonprofit organizations, or can they be private? Can they be city agencies? I know each partnership has to have at least 2 organizations, but are there more details about the types of organizations they are?
yeah, it's really an excellent question. The goal of and probably we will give more information out to this in writing. I want to be clear that the goal of the community benefits funds are to go to nonprofit organizations that are serving city families, Cambridge families. So I want to be very clear about that. We also do expect or think that there are cases where somebody may want to partner with government agencies or the Health Alliance or the the Housing Authority or part of Human Services, whatever. And so that is a possibility. I think, we will try to be more specific about that and then answer in writing. I think is probably the best way to answer it. Probably hard to say more than that.
Hi. In the interest of real collaboration and transparency, because so often grant requests are set up to be competitive, which is odd because I think we all want to advance this in whatever way we can. Is there some sort of clearinghouse or online way that we could share ideas and meet each other in that way? Because it's really hard as somebody who's a very new nonprofit to try to meet everyone in the room to find a lead organization that might help, we might partner with. because I think in the end, we all want the same things, if that makes sense. So I suppose it's a new sort of paradigm for grants. We all want the same things, but we're competing for the same amount of money, but I feel like maybe there's a different way to do it. Am I being clear?
Sure, I'm Ellen Seminoff. I'm a member of the committee and work for the city. And I think that we don't think that we can set up the entity, but what we're trying to do, because we totally understand exactly what you're saying, I think as you came in, we were letting you know that we were going to be putting on our website the names of all and email addresses of all the partners who came today, because we want to make it as easy as possible for you to reach out to the other individuals who've expressed an interest by being here today. So that we want to make that easy for you, but we don't feel like we can actually facilitate the creation of those partners beyond trying to do what we can to make it easy for you to find each other. And that was also why we set up time at the end of today for people to be able to network, so that as people are interested in talking to each other and making plans beyond today, that you can do that at the end of this meeting.
Any other questions? Randall's going to get his exercise.
Thank you so much. I just want to be really clear about the language about supporting. Is it that we particularly want to support families headed by women, or that it may only be families headed by women?
Our target population are families, low income or poverty level, and then particularly. So it particularly to me does not mean only, but there is especially as you look at the demographic information, it is a very vulnerable population in Cambridge.
Definitely. I have another question, if I may. I wanted to encourage us to think about, I think that for this time, all the work has been really great and is set and is good, but maybe in future iterations, considering the poverty levels that we use. I know we're using the poverty level threshold and then the HUD threshold, but we already know that in Cambridge, for example, a family headed by a single woman that has children in childcare, they need at least $73,000 to meet their basic needs, so we might want to consider moving that in future iterations.
Okay, thank you. Any other questions? Okay. Still opportunities to submit them, and we also have January. So at this point, we're going to move on to the data and the demographic presentation. And I'd like to introduce Cliff Cook, who's I'm happy to say, the city's demographer. I think that's a wonderful title. And Cliff will come up. And he will be the one to answer questions on his own presentation.
All right, so before we get into the data, I just want to make a few general comments about it. Most of the information that we're presenting comes from the Census Bureau from the American Community Survey. The American Community Survey is a survey, it's not a census in the sense that everybody in the community is asked these questions. So there is a margin of error involved with much of the data that's here. I don't talk about that, but it is something to bear in mind. You should consider many of these figures as generally representative of what is out there, but not the exact truth. So with that in mind, let's proceed on. So I always like to start with the overall population of the city. Let's take a step back for a moment, so to speak. If I included 1950, you would have seen the city's population topped out around 120,000 at that time, and declined steadily until about 1980, as there were a lot of societal changes, a lot of changes in how people lived, how baby boom sort of moved through the generations, people were moving to the suburbs, there was deindustrialization, factories were closing, the nature of work was changing. Around 1980, things population-wise hit roughly about rock bottom here. About 90,000 people were living in the city at that time, 95, I guess they're showing here. But you can also start to see there was starting to be more diversity coming in. The Hispanics at the bottom here is this little brown piece. We'll talk about race and Hispanic ethnicity in a moment. But you can see from 80, 90, 2000, 2010, the population is growing, diversity is growing faster. Around 2010, the population was measured at being around 105,000. The current estimate from the Census Bureau is around 113,000. Personally, I think that's a bit high, but I wouldn't be surprised if we were at that level or even a little bit higher by 2020. There have been 6,000 housing starts since the 2010 census was done, which is an enormous number of housing starts for a community of our size and age and nature. So just moving on. So the diversity, how does it break out in the city? The city itself is diverse in its diversity. The three neighborhoods with the highest level of either people who are not white or Hispanic or both would be North Cambridge, the Port, and MIT campus. Now I've got these two starred because what we're seeing is that the level of diversity in these two neighborhoods appears to be declining. In this case, it may have more to do with MIT admission rule priorities and who's applying to the institution. But I think what we're seeing in the Port is a bit of a different animal. We're seeing there some of the gentrification and pressures we're seeing from housing price increases. At the same time, we're seeing growing diversity in North Cambridge. And I think for those of you who are familiar with the city, that probably comes as no surprise. And just the sorts of folks you see walking around there really has shifted, I think, quite dramatically in the last 10 years. Within the city, you get some sections like Agassiz and West Cambridge that are pretty white, pretty upper middle class, if not a bit higher. And you get other neighborhoods that are a bit more diverse in their nature, along the western part of the city, through the center, Cambridge Port, and then Wellington and Harrington, which is, in some respects, is becoming the lower income neighborhood, so to speak, among the city neighborhoods. They're not seeing the level of pressure there, at least not yet, that we've seen in the Port. So at the present time, 62% of the city is white and non-Hispanic, but among those people who are 18 or younger, 50% are white and non-Hispanic. So in other words, half the population under 18 is either not white or Hispanic or both, which is a pretty striking finding. I think we were starting to see that number decline looking at the 2010 numbers, but it seems to have reversed again, and now it's that diversity level is increasing among people who are very young. I'll say good very young is how old I am.
Can you move closer to the mic?
I'm sorry.
Yeah, thank you.
Okay.
Oh,
That does help.
Yeah.
Actually, I prefer that. I think if I'm moving over, we'll be able to read my notes very well. Can you folks hear me now?
Yeah.
My apologies to those who see this later. Let's move on. So just jump back a moment, just a little bit about diversity. Diversity is measured in a number of ways. I won't get into all the ways the Census Bureau does, but the two that bear in mind here is they look at race and they look at Hispanic ethnicity. They are not the same thing. You can be Hispanic and any race. You can be any race, any Hispanic or not Hispanic. You can also be two or more races. For convenience here, I've lumped together several small racial groups and anybody who picked two or more races. But it's interesting if you look at those groups, that little piece of the pie, that part's been growing very rapidly in recent years. So household trends. So what's a household? A household is anything that's not through quarters. It's more or less what the census defines. That doesn't really help most of us. A household is a living unit where pretty much you can close the front door and lock it, and you have your own bathroom and kitchen facilities to some degree. Now, we all live in households, most likely, unless there happens to be who live in a dormitory here. SROs are considered housing units or households for census purposes. Group quarters is everything else. In Cambridge, 90% of group quarters is dormitories. There are some nursing homes and some other smaller group homes and such. But here we're just talking about people that are in households, which will be about 85% of the population. So we have about, according to the census at this time, we have about 45,000 households. How do they break out? Well, about 40% of households are family households, meaning that we either have people that are, well, what's a family? That's a good question. Think about it. So a family is 2 or more people that are related by blood, marriage, or adoption. So 40% of households are family households, 60% of households are non-family households. The biggest slice of the pie is people that live alone, that's 38%. We are exceptional in the large number of households we have that people live by themselves. That number is declining in recent years, probably as housing prices have gone up. Among family households, that include all households with minor children, they are about, in total, about 20% of all households. 18, 19, 20%, depending on which iteration of the American Community Survey you look at, which is a fairly low percentage. We have a low percentage of children overall. About 12% of our population is under 18. That's one of the lowest in the state. The only comparable communities would be Amherst, which is a lot like us, and Provincetown, which is not, but it has its own set of challenges in that regard. So we have a lot of married couple households that don't have children. We have some number of single parents with children, though I think that number has been dropping. Roommate situations have been increasing, and married partner situations have been increasing over the decades. So families of children, this is where I think it starts getting more interesting. We're breaking it out here into everybody, 3 of the racial groups, and the Hispanic group. And people, again, who are Hispanic can be members of any one of these racial groups or any other racial group. So overall, most families with children are married couple families in the city. That's the typical experience for someone in Cambridge. If you go to Greenwich, if you go to elementary schools, and you start asking around, on the whole, that's what you're going to find. That's not to say that's what it's true for every group. As you can see, for the Black population, African American population, it's a very different experience. Similarly for the Hispanic population. Now, whites and Asians, you'll tend to see this in another slide I have here. If I were to do the bigger presentation, you tend to see this pattern repeating when these 2 groups are more similar and these 2 groups are more different, more similar to themselves, but different from the other 2. However, I think looking at the Black and Hispanic populations, there's more going on underneath the surface there. The Black population here is largely one that is, I believe is more longer-term residents. It's a very high proportion of people who are foreign immigrants, who are less educated and can earn less income, as we will see. Hispanic population is a bit of a different situation. It's really very heterogeneous. We don't have a predominantly Dominican or Puerto Rican or Salvadoran populations you might find in some communities in Cambridge. We've got a little bit of everything. If you look closely and look at where they live, you'll see there are a lot of Hispanics living in proximity to the college campuses. Because a lot of people who are here who are Hispanic and are Hispanic families are here because they are connected to Harvard or MIT. So if you dig deeper, what you start to see is there's really 2 subsets of Hispanic populations. One is probably more like the average, overall average, and another is probably more like the Black population. So, I think some of the slides will come. Let's start here. Maybe get right here. And the order that's not that big deal. Just want to move ahead of my notes, excuse me. So, the living wage. Living wage is another definition here, because I don't think it's clear what it is. It's the income needed to attain a modest yet adequate standard of living. There are a couple different sources for this information. I'd like to use the one from the Economic Policy Institute. I think they do a better job of covering miscellaneous expenses than the MIT calculator that we often see referenced. So I was able to go to the calculator and put in different household configurations, and they'll tell you what they think is the amount of money that households earn to live in Cambridge. I take those numbers, I swap out the housing expense, and I swap out the expense from a median market rate cost for a rental unit of different sizes. It would be a 1-bedroom here, this would be a 2, this would probably be a 3-bedroom. So that's how we come up with these numbers here. So these values are would be annual living wage threshold for that household. So looking here, you can see that among married couples, about 25% don't make the $83,000 threshold. For a married couple with one child, that's not preschool age, not a teenager. Now, about 25% do it at the threshold, about 75% do it. But then you go up to one adult by themselves, and only about half make it. And you start then looking at single-parent families in the situation, it becomes much more difficult very quickly. Among one adult with a preschool-age child, about 65% do not attain the threshold, and among those with school-age children, about 75%. So this is, it starts to give you some sense of, these red bars here start to give you some sense of the population that may be in some level of distress, but not necessarily distress that's obvious. They may not be the ones who are going to the food pantries, but they're having trouble making ends meet every month. They're probably living paycheck to paycheck. And particularly those kids are probably scrambling to provide for their kids, provide them with the kind of opportunity that they see a lot of other folks having. Moving on. So income by race. So this looks a lot like that last slide I showed you on family structure. You'll see fairly low proportions of households earning less than $125,000, and a very high proportion earning more. And over the years, we've slowly seen much more of a migration in this direction, where the income distribution has been becoming actually bimodal in some respects. It used to be more like this at one time. And what we're seeing is that the lower income groups, less than 20, less than 40, those numbers, percentages are actually fairly stable. And my theory, and it's only theory, is that most people in those groups at this time are either graduate student households who have other sources of income that aren't accounted for here, or they are families in the community or individuals who probably already have some form of affordable housing, or living in some special situation, let's say, where a family member is, in effect, subsidizing their housing costs. At the same time, you're seeing this enormous increase in households earning $125,000, $140,000 or more. Very different distributions. Again, I think not surprising. And then, as I was referring to extents, here you can see the extents got a little more that bimodal distribution. I think here we're seeing the different subgroups, those who are associated with the university and those who are not, and very different income profile, and probably opportunities and lifestyles. Asians very much like whites, but not quite as much. There still are low-income Asian groups within the city, Bangladeshis, for example, or some of the Indian groups. Blacks are in a very different situation, and not terribly surprising, unfortunately. If you look at the data, it's a little bit right now. So digging into poverty, so there was a slide earlier showing you what poverty levels are, and they are very low. I have a hard time understanding how anybody in this city can live with income less than poverty level, but people, a lot more are obviously doing it. One confounding factor we've had here over the years, people say, well, a lot of folks in the poverty level, but aren't they all students? Or are a lot of them students? And the fact is, a fair number of them are. About a third of the people who are under the poverty level, individuals we're talking about, are college or graduate students living in the community. Particularly with college students who are often living with their family, the family may itself be in poverty, so it may not be entirely fair to categorize them as graduate students in that regard. But for clarity's sake, I've calculated the numbers for these different subgroups for all persons, and then I went back and removed students from the population. And you can see that way sort of changes things. When you look at all persons, it's uneven, but you can't say that one group really stands out. But once you take the student population out of the picture, you can see that the Black poverty-stricken population really stands out from the others. And it really does. And the white poverty rate goes down to about 30%, the Black rate goes down to about 22%. So the white rate dropped about 3.5%, I think. The Black rate drops to about 2% after the adjustment. The Hispanic rate drops significantly. Again, I think that's a continuing story in telling that. Foreign-born, that's interesting or not, but that's such a very gated group, I'm not sure what I would think about. But a lot of people who are here are students. you can see that if you look at the MIT campuses and look at, let's say the MIT and Harvard campuses and look at people who lived overseas last year who are now living in what are heavily dorm-driven areas, there's lots of folks who move here every year from other countries who live around Harvard and MIT. What happened? Let's turn it off for a second and turn it back on. There we go. Okay. So here we're looking at family households only. And I'm breaking it out to some of our familiar groups here. And you can see that, again, there's very different numbers for different groups. White non-Hispanic population is really pretty stable in terms of its poverty rate. Black rate's going up and down. There's a couple of possible explanations for that. One of them could just be that statistical error may have occurred and they have overcounted here or undercounted here or both. What I think is maybe more interesting is to look at time periods where they're having the Great Recession here, and here you're out of the Great Recession. So maybe, not surprisingly, people in lower income tend to have lower levels of education. They're often the first folks to lose their jobs when push comes to shove, and they had much higher unemployment rate and much lower incomes during the height of the Great Recession. Our employment picture has vastly improved, as you probably are aware, and as a result, their income situation has improved, particularly toward the very low end of the income scale. It may not mean these people are making $100,000 a year, but they're probably making a little bit more to get by, maybe more than 20, more than 30, whereas before they were making 10 to 12. Asians, pretty stable. Hispanics, pretty stable. So again, just going back to this. So again, this group always seems to see that it always is a different pattern in Cambridge. Childhood poverty, I can use the same colors here, but this is not broken out by race or ethnicity. So some things have been fairly stable. People under 18, surprisingly, the percentage of people under 18 in poverty has not changed all that much. What has changed over the years, I think, has been a decline in the number of people under 18 overall. So the proportion may be the same, the number has actually dropped. Children under 18 with single parents, much worse situation than before. There's families in a much higher level of stress than was once the case. Now here, this is interesting. Female-headed households with female-headed families with children under 18, the poverty rate dropped. This could be because this may count pushing these things I'm saying. There just appear to be a whole lot fewer of these people than there were 10 years ago. These kinds of households, they've declined in numbers substantially from 10 years ago. We'll get to that in a second. New mothers in poverty, I'm always surprised at how high the rate of new mothers in poverty is. Some of that may be, again, the graduate student effect, but I don't think all of it is. So the next 4 slides are a lot of numbers. I'll move them fairly quickly. They'll be up there, though, as a resource on the web for something that you can look at as you think about writing your proposals. So poverty status for different groups. So here I'm comparing 2 iterations of the American Community Survey. They're non-overlapping. One pre-Great Recession, one more or less post-Great Recession. Not exactly, but close enough. You can see overall the numbers have dropped in many cases. Not to say they're necessarily good, but the numbers have been dropping. The percentages have dropped a little bit. I put no change if there's less than 1% change in that category. But if you look at the actual numbers of households or people, you can see there's just a whole lot less people in poverty in many cases. So 14,800 people to 12,900. Single parents with children under 5, I think they're 200 in our country, which I think is a really striking change. But in general, you're seeing the numbers going down as I think these folks' housing opportunities for these people have declined in Cambridge. There are a couple numbers that stick out as one of the footnotes. Unrelated people over 15 and non-family households, again, are very much subject to the graduate student effect. So they tend to have high rates, but I don't think that the rates that you're seeing there are necessarily reflective of what you're seeing in the non-student population, whereas much of the rest is the non-student population that we're seeing. Particularly looking at the numbers. Public assistance program participation. Just to give some sense of scale, the number of households that participate in different types of programs. I've got information from Social Security for their various programs. So not huge numbers, but not insignificant numbers out there. A lot of them getting Social Security return, but that number is probably about very quickly in the next few years. Cash book assistance, very few people get cash book assistance anymore. In the amount you receive is very low compared to what it was 10, 20 years ago. If you adjust for inflation, it's a half to a quarter on average rate of household would receive 20 years ago. SNAP with a couple different sources. The best one is the programmatic data source from the state. State started publishing in the last few months SNAP data by zip code for every zip code in the state, as well as participation in where programs can, and I forget there's one other one that's similar to what Paul name of. That is not a period. I think a date that was converted to a number there. My apologies. That would be between October 2017. Free or reduced price lunch participation in schools, about 44% of children in this case. So transitionally having children, emergency to the elderly and disabled. Not a lot of households are receiving those kinds of cash programs. In these cases, I was able to get the average benefit from the Social Security or the American Community Survey. So folks that are consistent in any of these programs are not getting a lot of funds. But they may be above poverty level in cases, so we take this and put it together with something else and above poverty level, even though you're just scraping it off. A little bit about food stamps. Since we go a little bit more detail on those, let's flip to that page for your notes. Overall, about 4,000 households and 6,200 individuals who receive food stamps. The dots are businesses that are qualified to take food stamps, either the food sellers of various sources, supermarkets, corner stores, other types of businesses. So who tends to receive a lot of, what populations receive food stamps at higher rates than the rest of the overall population? More than 30% of those with income below poverty level receive food stamps, single mothers, and black population. Just under 30% are households with no workers and members who have a disability. One of the surprising things you'll find is that among households in the poverty, only 33% receive food stamps. So I'm not sure how these folks are doing. If you went back a few years, during the Great Recession, there were some different program guidelines in place, and there were much higher numbers of people receiving food stamps in the city. At one point, we were up to 9,000 individuals and 5,600 households. But once the waivers were removed, and the waivers primarily dealt with people who are working age and not working. Once those waivers were removed, the numbers dropped very quickly. I remember seeing that in the data and asking about it. I thought somebody made a mistake. Then I wanted to fill me in what happened, and the picture came very clear very quickly. So, where in the city do people in? Oh, jeez, this thing is harder again. So this is by census tract showing you which tracts tend to have a higher share of the citywide population that's in poverty. North Cambridge stands out. Next one would be this tract here, which primarily consists of New Washington Hills and Newtown Court. There's a little bit of other residential area next to that, but it's almost all those two developments. 6% here, it's the core area of East Cambridge. Surprisingly large number, I think, in North Point. But I think what's going on there is that we have a lot of affordable housing units in those developments, and so it comes through the inclusionary program, and inclusionary units can be rented by people with a housing voucher, which makes it available to people that are under 50% median income and often by poverty level. And then 8% here, that's probably largely affected Golden Park, I guess. So a couple final slides on neighborhoods. Just trying to look at where poverty is concentrated in different neighborhoods. I've tried to highlight neighborhoods that have a high number of individuals or a high percentage. I did it for everybody, and then I took the students out and ran the numbers again. So 700 is roughly 1/13 of the population in poverty once you take out the students. So there is the neighborhoods that are above average. average, above the mean, you could say. And it also can be ones at higher rates. So there's the citywide rate, number of people citywide who are in poverty, those are best students. And then what are the contributing factors? So these colors, just refer back to the prior chart. This is a reminder. You can try to connect it to the different characteristics of different neighborhoods. So you can see, for example, neighborhoods that fall in these darkened categories tend to have 3 or more characteristics that flag them as being at risk for higher levels of poverty. But they're different in every case. In the neighborhoods here, I think those of you who don't see our neighbors play very different personalities, and I think that's reflected here. Okay, so that's my presentation, and I'll stick to it. Are there any questions I can answer? No, I'll try to use the mic here when the ones to bring the mic around.
When you refer to the cash public assistance, does that include the earned income tax credit?
No, it does not. And that would be something that'd be interesting to look into, and I should do that.
Thank you.
The data is available on that through the IRS website. I think you can get it at the zip code level. Other questions? Well, if you think of anything later, feel free to submit them, and we'll provide answers to the guide.
It's not really a follow-up, it's a different question. You referred sort of in passing to the black population, including a number of foreign-born. Are they mostly folks from Ethiopia and Eritrea? Do you know more about that? It's a little bit hard to tell because once you start getting down to the small numbers of people, the data isn't very good. There are substantial numbers of Haitians, so that number has been dropping steadily as their financial situation has improved over the years. I think what we've seen in the last 20 years is Haitians have entered more into the economic mainstream. They earn more money. They want to buy a house. They can't afford to buy a house here. They move out of the state. We do have a substantial number of Ethiopians. Eritreans are hard to get a handle on. Unfortunately, it's the way the census is providing data. But clearly, they are present, as are Somalis. We see that more in the school enrollment data than we see in the census data per se. Those are the 3 groups that stand out. But I think there's quite a lot of people, small groups from a bunch of different countries.
Good. I have a question about the effects of gentrification and what it is, what share of the population or what populations are moving out because of gentrification. You mentioned gentrification and you do see some demographic shifts?
Yes. Do you have some information on that? Just give me a moment to take it out, please. Hopefully I grab it. But what you can look at is where people lived last year, which is imperfect. But if you're looking at individuals, that's what we have. You can also look at households, but I don't have the information handy. Let's see if I have it here.
You might be able to provide it.
Yeah, if I don't have it, I will provide that. It's not hard to do. I don't seem to have it here. I thought I did, but don't. I'm afraid I don't have that slide. I thought I had a copy of it with me from another presentation. But we can look into that. There are noticeable trends. And of course, you see students and young people tend to move there now more frequently. You'll see that among certain other groups as well. I think among people that are in poverty or very low income, they tend not to move as much, which makes sense. They have a stable housing situation and a stable if they can, because finding that one is so difficult.
Maybe this is an obvious question, but does Cambridge have an estimate total of how many families, low-income families or families living in poverty headed by a single woman there are in Cambridge? Is that the total figure?
Yeah, I think actually we have that in here. Female single parents in poverty, about 600.
So that 100 number is referential to the children?
That's single parent, single A female single parent family with a child under 5. There's only about 100 of those, according to these numbers from the census. I have to point out that because these numbers are fairly small, they can gyrate pretty rapidly from year to year. But it would suggest that among single female parent families that they tend to have older children. They tend not to have one or more young children. They tend to have one or more older children. People with kids that are 5 to 17, as opposed to under 5.
So that 600 number could include female single parents with children above age 18?
Yeah, not above age 18, I believe. In this case, it's, well, that's a good question. No, it doesn't include kids above 18.
Okay, thanks.
This is just poverty.
This is just poverty, not the overall population, just poverty. And these numbers are here to give you a sense of scale.
This doesn't include families living in shelter, or does it?
That's a tough question because I'm not convinced the census does a great job counting the homeless or people that are in that kind of transitional situation. If they were in a housing unit that was run by Heading Home or Transition House or something like that, they would probably be captured. If they were in a shelter per se, they would be considered as living in group quarters, and the American Community Services doesn't do a good job of group quarters. So I would say it probably doesn't.
We have a question that's
So this is kind of a trend question.
Sure.
The population is going up.
Yes, it is.
The poverty rate is going down. Is there a way to slice and dice the data to tell us the story about, is the reason for that due to people who were once low income, are they still living in Cambridge and they're no longer low income, or have they moved away from Cambridge?
And the other possibility is their incomes increased, they're no longer low income.
Well, that was my first.
Okay,
Two scenarios. Are they no longer low income but they're still living in Cambridge, or they've moved away from Cambridge and that's contributing to the drop in poverty rates while the population rate is going up?
We don't have a good answer for that one. I don't think you can slice and dice the data necessarily. Among individuals, you only look back 1 year at who lived here and who didn't. You do tend to see that the people from poverty households tend to have a lower move-out rate year to year. Probably can do some work with another census data set called the PUMS that might allow you to take a closer look by income.
So, I just have a follow-up. So, maybe this will happen after the evaluation of the community benefits funds project, but I think it would be really important to know if the work is having an impact. Or, right? Like, isn't that an important data point? Because if the poverty rate's going down just because people are leaving, that you can make the assumption that the work, what do we do about the work? Is it not an impact? Is it not? Is it or not?
Yeah, it's a good point. It's a good point.
I was looking at the families with related children number and wondered two things. Does the housing authority, are people living in public housing represented in that category? And I'm thinking, well, let you answer that first.
Yes, they are. All housing units are covered by the American Community Survey, all households. However, we are not able to distinguish among the households who are living in capital A affordable housing and those that are living in the rest of the community. So we don't have a way to pick those out and look at their characteristics specifically.
So this could be higher, the number of people living in families at the poverty level with either grown children or teenage children, younger children that are living in individual households. Is that what you mean?
No, I'm saying that these numbers do cover the entire population, regardless of where they live.
Oh. Because I think one of the thought behind that question was that I'm aware of a number of families that have 30-year-old children living, because the children can't
move out of the house.
Yeah.
There's no place for them to live.
Yeah, a household like that is a good chance, even if all members are earning relatively small amounts of money, they would not fall below the poverty level, just because the number of people earning income kind of small in that case.
Right.
But yeah, it's an interesting thing I've not had a chance to explore, multi-generational households among adults. I think we probably are seeing more of those. I think a corollary to that is the declining number of single people living by themselves who just can't afford to do that anymore. And that number has dropped 3 or 4% for us since 2010, which is a pretty significant swing.
I can appreciate how difficult it is to really read the story on the data.
I actually just wanted to offer a ray of hope for the point of concern that you raised. I am an evaluator, and what you would do in that case is actually look at the outcomes of the people who are actually participating in the projects that you're all putting together, in addition to the population level changes. So you wouldn't just look at the population level and draw some assumptions about things. There is hope for demonstrating the success of your work.
Any more questions? Oh, yes.
I apologize for my confusion. So we're talking generally about moving the needle on these top tier needs for about 600 families, theoretically. Is that correct?
If you're looking at female single parent families in poverty, yes.
Poverty.
In poverty.
Low income.
Low income, no. Low income is a different measure.
Different, okay.
That's different.
Okay.
Low income is a higher level of income than this, and I don't have a way of getting at that right at this point.
Got it. Okay.
But it gives you some sense of, you take the number and double or triple it, and probably start getting the number of populations.
I just want to say, if you could correct me if I'm saying this wrong,
If other people want to hear your name.
Yeah. Let Cliff correct me if I'm wrong, because the last thing I want to do is provide any misinformation. But if you look at the information that Cliff gave you about free and reduced lunch from the schools, the percentage, the free and reduced number, which was something like 44%, that is lower than the low income threshold we are talking about. So what that's telling you is that 44% of the children in the Cambridge Public Schools are in families that would qualify as families that could be served. So if you're trying to figure out whether there are a lot of families, that would be one point of reference.
Yeah.
Is that?
Yeah, I think that's accurate.
Since you have that slide up, so 44% of the children qualify for free or reduced lunch, but only 9.2% get SNAP. Does that mean they're very hungry people? Or is there a different threshold in terms of income for SNAP that's lower than school-based lunch? Yeah? Okay.
Yeah,
that freaks me out. I was like, hungry people everywhere. Because that's huge.
I can't see that. And people in this room know far more about feeding programs. I'm looking at you there. And you're nodding your head saying, yes, there are a lot of hungry people. I know that. You look at the weekend backpack program, which is something we didn't have until a few years ago, where kids were going hungry over the weekend, coming to school, I'm guessing on Monday, famished, unable to get to work done. So yes, it is a big problem. Any more questions?
Okay, well, thank you
What's
all.
right.
I think we're done with the data presentation. Cliff, thank you so much. So this information will be going on the web. So the formal part of this presentation is ended. So